Whether and when to take hormone replacement therapy, also called HRT, is a deeply personal choice. HRT is used to bring your body more in line with your internal experience of gender. Sometimes using hormones can reduce gender dysphoria. Sometimes people use hormones or surgery or other medical interventions for safety reasons. We're less likely to be questioned or even attacked if our gender expression falls in line with the binary or others' expectations. You should take hormones when you've fully researched your options, feel that hormones are a positive next step for you, and you're okay with the fact that the effects are not fully reversible should you stop taking them. It used to be that people needed to spend a certain amount of time living publicly in their affirmed gender before going on hormones, or in therapy before starting this process, or be on hormones a certain length of time before having surgery. But we now understand that these guidelines can be overly limiting and they're not a fit for everyone.